Great. So the webinar is not being recorded. We go ahead and try to save that for partners that are not able to attend us live and engage with us in dialogue. So it is being recorded. Today is our second NLAD network call. And part of what these network calls are created for, designed for, are to develop a platform for partners that are interested in hosting events for NLAD to kind of serve as dialogue and build partnerships as we kind of get closer to the launch date for NLAD 2016. And again, my name is Tony Ochoa. I'm the Program Manager for National Latino AIDS Awareness Day at the Latino Commission on AIDS. So again, thank you. I'm the guy that's usually sending you emails throughout the course of the next couple of weeks. So if you have any questions, I'm also the point of contact for that. So I would love to kind of engage you all in conversations and making sure that we have a great and successful NLAD 2016. The lines are all currently muted, so if you haven't had a chance, we generally try to keep the lines muted to eliminate background noise throughout the course of the webinar. There will be sections during the course of the webinar where we will unmute the lines to have dialogue, and in a minute to introduce ourselves to everyone on the call with us this afternoon. Just to briefly go over what we will be doing today as far as what the agenda looks like, we'll do welcomes and introductions in a minute. We'll do NLAD announcements, partner spotlight, where we'll have one of our partners in San Diego speak to us about what he has planned for NLAD 2016. And in doing that, I want to make sure that I solicit other partners to offer a glimpse as to what they're having planned for 2016 and kind of give everyone else some idea of what they might be able to do. So if you're interested in kind of speaking about what you'll be doing for NLAD 2016, please do so. Hit me up, send me an email, and we'll give you a minute or so to kind of talk about what you're doing. And then we'll go into our webinar topic for today, which will be HIV/AIDS among Hispanics, Latinos. Oh, I'm sorry, that's not right. We'll be talking about competency, humility, and responsiveness, Latinx and Latino MSM populations. I forgot to update that section on the agenda. I'm really sorry about that. So again, we'll be talking about competency, humility, and responsiveness with Latinx and Latino MSM, and that will be done by my colleague here, Michael Diaz, who is a behavior specialist with our capacity building team. So I'm excited to kind of pass the time on to him to kind of speak to us about that topic. So to briefly go over who we are, about NLAD. NLAD was established in 2003 in response to the impact of HIV/AIDS on Hispanic Latino communities nationwide, including DC, Puerto Rico, the U.S. Virgin Islands. It's a national community mobilization effort with some social marketing elements to it. So we really try to raise awareness to Hispanic Latino populations through collaborations with national partners. And when we say national partners, it could be anyone from a church group to a student group to an organization to a program within an organization. Anyone we consider a partner in hosting an event. And an event can be anything from engaging in social media posts to hosting large-scale events, cultural events or testing events. Anything within your organization's capacity would be great, and I think any bit helps. So we welcome anyone to engage with us and becoming a partner. And we would love to kind of continue to share resources with you to do things like that. This is a glimpse as to what the posters look like. Posters have looked like in the past, and I'm excited to show you what the visual poster would look like for this year. And that's what I will be announcing right now. So our NLAD announcement that we'll be bringing forward is the display of the visual for this year's poster. As we discussed in the previous call, this year's theme was built on previous year's theme. Last year's theme was You and I Will Defeat AIDS, and this year's theme is We'll Defeat AIDS con Ganas. So it is a bilingual poster, Spanglish poster. And this is what it looks like. You guys might have noticed that the poster in previous years was landscape. This year we decided to change it up a bit and go with this horizontal approach to the poster. And as always, there's a space at the bottom that you'll have an ability to enter your event information. And again, what we were planning on doing is making this poster available on the NLAD website when it goes live at the middle of September. So you'll be receiving an email announcement within the next couple of weeks as far as when that site is live. And you'll be able to order and download resources So you'll be able to download and also order the NLAD poster. We send partners that request it a maximum of 20 posters for anyone that would like it, as well as other resources like fact sheets, resource guides, things like you can order testing kits on the website as well. And we ask again, if you're hosting an NLAD event, please don't forget to add the NLAD event on the website. It really gives, we do a lot of effort in making sure that we publicize local community members going to the website and finding testing events or NLAD events or places they can get tested. So we ask that you leverage that resource and that publicity that we put into making sure that partners go to the website and also enter their event information in doing that. So only other announcement before I pass it on to Michael and do introductions in a minute is the next webinar after this one, we'll be talking about Hispanics and Latinx and PrEP. So we ask you to join us for that webinar, which will be happening on Tuesday, September 13th at this exact same time. So with that said, before I get started, I want to go ahead and ask you all to introduce yourselves. So I'm going to unmute the lines in a minute. I'm going to ask you to give us your name, your city and state, and also what you do. So I'm going to go ahead and unmute the lines now.
The conference has been unmuted.
So the lines are currently unmuted. We welcome you to give us your name, give us your location, city and state, and then give us your agency and what you do. So again, my name is Tony Ochoa. I'm the program manager for National Latino AIDS Awareness Day here in New York City, and I'm with the Latino Commission on AIDS. So anyone can jump in at any order.
Okay, my name is Wanda Flores Brothers. I'm calling from Fort Worth, Texas, with Tarrant County Public Health Department.
Right, Tuesday, right. So if she wants to start tomorrow.
My name is John Thompson. I work at the Faith Medical Center Primary Care Clinic. I'm a project director for a behavioral health navigation grant in Brooklyn, New York.
Good afternoon.
Come in, what?
Intervention Coordinator, Gay Mental Health Crisis, New York City.
Good afternoon. This is Jose Colón Verdecia, Community Outreach Coordinator at the New York City Department of Health and Mental Hygiene.
Hi, this is Jackie Goldman, coming from Santa Fe, New Mexico at Southwest Care Center, and I work in outreach in HIV and Hep C testing.
Awesome. Welcome.
Hi, Melissa Sandell, Outreach Manager at Dominican Women's Development Center up in Washington Heights, New York.
Hi.
Good afternoon. This is Martha Guerrero, calling from Dallas, Texas, with AIDS Arms Viviendo Valiente program.
Good afternoon, everyone. My name is Ernesto Zagar. I work at the Gay Men's Health Crisis in New York City. I'm a peer educator and co-facilitator for HIV positive Black and Latin men.
Hello, my name is Jim Eisen. I'm calling from Lake City, Florida. I work for the Florida Department of Health Services Rep HIV/AIDS.
Hi, I'm Tanika Joseph. I'm calling from Birmingham AIDS Outreach in Birmingham, Alabama, and I am on the 15-1509 CP grant.
But if she's not, then we could do.
Good afternoon. My name is Ricardo Bonick. I'm calling from Georgia Department of Public Health, where I am a regional consultant in the STD section.
Hello, everyone. I'm Cynthia Hurd. I'm calling from Gainesville, Florida. I work at the Lockaway County Health Department. I'm the regional EIT for Area 313.
And I did 2 of mine, so I did a...
Good afternoon. I'm Jessley Santiago from Community AIDS Network in Sarasota, Florida, and I do prevention awareness.
Good afternoon. My name is David Bedez with League of United Latin American Citizens, LULAC, the national headquarters in D.C., and we will be working with 10 of our local councils on our national platform for National Latino AIDS Awareness Day.
Hello, Michael Lamb calling out of Sarasota, Florida from Community AIDS Network. I'm the prevention specialist.
Hi, good afternoon. My name is Henry Jack calling from New York, Brunswick.
Hi, this is Terry Smith from APLA Health and Wellness, where I am the Associate Director of HIV Prevention Services.
All right, give me 1 second, guys. Someone just, you can hear somebody's conversation. I heard about a case conference and a Go Brian, so I want to make sure that we don't put anyone's information on blast. So please, if you can eliminate some of the background noise, that'd be great. And again, we're going to mute the lines again in a minute once we're done with introductions.
Hi everyone, my name is Brenda Cruz. I'm calling from Proceed National Center for Training, Support, and Technical Assistance. We're a SIGA provider, and my title is Manager of Training and Distance Learning.
Brenda, thanks for joining.
Tony, hello, my name is Tanya. Hello, my name is Tanya Zurita from Proceed. I'm the program coordinator for the Health Initiative Unit.
Tanya.
Tony, this is hello.
Eddie Orozco with Brightline in Miami.
I love it.
Program facilitator at Tester.
Welcome.
Hi, my name is Mary Beth Levin. I'm with Georgetown University School of Medicine here in Washington, D.C. I'm a professor of medicine, and my focus is on harm reduction.
Welcome.
Hi, this is Luz Reyes, and I'm calling from Orlando, Florida, the Orange County Health Department, and I'm here at my position is Prevention Training Consultant, as well as linkage to care.
Tony, this is Deb LaBelle with AIDS.gov. I'm the partnerships director for the team and the team lead for all the HIV/AIDS observances, working under the direction of the U.S. Department of Health and Human Services Office of HIV/AIDS and Infectious Disease Policy.
This is Jada Cardone. I'm sorry. My name is Elizabeth Pineros. I'm the clinical director for Proceed Inc. in Elizabeth, New Jersey.
Welcome.
Hi. Hi, good evening. This is Lilia Fletcher Moreno. I'm from Louisiana. I'm working for Southeast Louisiana Healthcare Education Center, specifically for Marketplace as navigator. Thank you.
Hi, I'm Jada Cardona. I work for the Louisiana Office of Public Health, HIV STD Prevention Division, as a prevention assistant.
Hi, this is Vanessa Arias Martinez from Proceed Inc. I'm a program manager of training and distance learning at the National Center for Training, Support, and Technical Assistance.
Ernesto Hernandez from the LGBT Network in Long Island, New York. I'm the early intervention specialist.
Hi, this is David Flores from the Los Angeles LGBT Center. I'm a health education specialist under the Sexual Health Education Program.
Welcome.
Hello, this is Gabriel Guerrero Savage from Oklahoma City, from the Latino Community Development Agency. I'm a CPR, counseling, testing, referral, and I'm also the facilitator for the support group for Latino men living with HIV/AIDS.
Hi, this is Rhonda. I'm from Tarrant County Public Health Department. I'm the Community Mobilization Coordinator here.
My name is Rebecca. I'm with Tarrant County here in Fort Worth, Texas. That's not good. Tell him not to do that. He shouldn't be taking one dose of Remdesivir with nothing else.
This is Carly Jane calling from Boulder, Colorado at the Boulder County AIDS Project. I'm the bilingual community outreach manager, educational presentations, and community outreach.
Great, so I think we're kind of chiming down on the introductions. Again, thank you for that. We generally try to keep this portion of the webinar when we do introductions open to everyone, so everyone kind of introduce themselves one by one. As you can tell, there is some background noise, so during the course of the webinar, we keep the lines muted. If at any point during the webinar you want to ask a question, you're welcome to do so through the chat function, or you can raise your hand and unmute your line. And you can unmute your line by pressing *6, and then pressing *7 again to mute it. So what I'm going to do right now is I'm going to put everyone on mute.
The conference has been muted.
So all the lines are clearly muted. You could probably hear us a lot clearer now that the lines are all muted. So again, we try to do that to eliminate background noise during the course of the webinar, and it'll make it easier for us to move the content. What I'm going to do right now is I'm going to ask my colleague Esteban Duarte. Esteban, I just saw you chatted me. Can you unmute your line by pressing *6? If *6 doesn't work, try *7.
How's that?
I can hear you now. Great. Welcome, Esteban. Esteban is one of our NLAD partners from San Diego, California. Last year he hosted a memorial, and he's with VIDA. He's the executive director of VIDA in San Diego. Do you want to give us a little more background on VIDA and also what you have planned for NLAD this year?
Yeah, definitely. Thank you so much. Good afternoon, everyone. VIDA's goal is to lower the HIV incidences amongst Latino children, male and female, and break down the walls of stigma that are associated with HIV and AIDS within the Latino community.
And so by doing so, what we host is a memorial service on October 15th at 5 p.m. at St. Paul's Cathedral. And for the first hour, there's going to be a non-alcoholic cocktail reception with politicians, and we'll have Ballet Folklorico de Sinaloa performing. We will have the first gay, lesbian, transgender, bisexual, queer mariachi group performing also with the Ballet Folklorico. And then for the first hour, and then from there, we will march into the church because it's also the last day of Hispanic Heritage Month. We'll walk in with Viva Mexico, and then we will have a memorial service remembering all those who've been impacted by HIV. We have the Honorable Councilman David Alvarez who will be speaking, and we also have a Nicole Ibarra, a transgender, who will be talking about HIV and AIDS in Tijuana and Baja California. And then I will be discussing the impact that it's had in our community over the last 35 years. And so that is what we give back to the community to remember all those people.
This sounds amazing, Esteban. And again, just based on the interactions we've had, I can tell you put a lot of thought and effort into having a great MLAT event. And I'm excited to hear how well it turns out this year again. So good luck with that.
Thank you. You know what, I actually just remember what Grandma always said. You know, focus, speak from your heart, be passionate, and it'll all come together.
Those are wise words. Those are wise words from your grandma. Definitely. So I think kudos to you. And we're excited. And again, we'll be in dialogue as you move forward to support you and what you're doing locally. Great. And again, thank you, Esteban. And I welcome anyone that's interested in kind of giving us some insight into their MLAT event on the next call to hit me up and send me an email. I want to kind of give you a spotlight to kind of introduce your MLAT event as well. So if you're interested in doing that, that'd be great. Let me know. So
the conference has been muted.
So now I'm going to introduce and pass the baton over to my colleague, Michael Diaz, who's our behavior specialist here at the Latino Commission on AIDS. Michael, do you want to introduce yourself?
Hello, everyone. Good afternoon. My name is Michael Diaz. I'm, as Tony said, bureau specialist here. So I work providing all sorts of technical assistance around HIV testing, prevention with positives, and a little bit of organizational development and management. But I focus a lot on sort of the behavioral interventions. So a couple of HIV testing, CLEAR, and a couple other public health strategies like ARDAs. But today, I'm actually sort of in the capacity of talking to you a little bit about these, cultural competency, right? Which is a framework that many of us are familiar with, that sort of is a lens that helps us understand the importance of working across differences, right? Because when we're providing services, whether that's testing, counseling, we're a social worker, we're designing programs, whatever your role may be, understanding and being able to work across difference is huge because your clients or patients may not always share the same culture you do, right? This is nothing new. This is something, again, that we talk about in the field a lot because we understand how sort of being blind to differences and not acknowledging and respecting and identifying difference can be very detrimental. It can completely derail services, programs, engagement, and care, right? So today I'm going to talk more about this idea of cultural competency and also to talk to you a little bit about some nuances, so some other frameworks or lenses that we use to talk about difference, right? And some of these terms are cultural humility, cultural responsiveness, right? And specifically in the context of working with Latinx and Latino MSM. So we've been using, you probably have been hearing this buzzword of Latinx. It's definitely has been picking up traction in social media platforms. And mainly it's been predominantly used by activists, but also researchers and scholars, right? And here I just have a very straightforward definition for folks who may not be familiar with the term, right? It is, Latinx here refers to a gender-neutral alternative to Latino or Latina, and even Latina. with the at symbol, right? Another way of thinking about it or saying it is that it's a gender-inclusive way of referring to people of Latin American descent. But why, right? Why the Latinx? So again, Spanish, like many Romance languages, is a very gendered language. So usually words or nouns ending in O denote masculinity. Words ending in A denote femininity, right? And even in sort of the overall grammar and process of the language, oftentimes the masculine form is sort of prioritized, right? So a really simple example, so if you're, for the bilingual speakers in a room, right, if you say friend, friend is typically amiga, ending in A, if you're referring to a female friend, or amigo, if you're referring to a male friend, or a male-identified friend, right? So if you have a room full of women, you could say there's a room full of amigas, right? But the second a male or a gentleman enters a room, it now changes, it's now a room full of amigos. So the priority, right, or the form is now masculine, because that's sort of the default, right? So in efforts to sort of get away from the gender binary, folks have been using Latinx to be gender inclusive and to capture those who, many of us, who are gender nonconforming or transgender, right? So I will be using, moving forward, I will be using Latinx, but again, it's in place of the masculine Latino. And here, this is super quick. Again, I know many of us are very familiar with the term MSM, what it means, but the reason I wanted to sort of include this slide is there are still many providers, and again, doing CBA or capacity building assistance on a national level really helps inform our work and the way we see sort of HIV programs and services. And oftentimes, people conflate and use MSM as an identity, when in fact it's just a behavior. So when we're talking about Latinx MSM, again, MSM solely is just referring to a behavior, regardless of actual identity, whether that's gay, bi, etc. Right? So I definitely wanted to stipulate that and sort of and explain also why I have MSM. Most folks are like, oh, we're very familiar with what this means.
Great. There's a question here, Michael, that Hada just asked, and she asked, why are we considering transgenders MTF and MSM as MSM, male to female?
Oh,
identified.
Yeah. So as it stands, and this is definitely is a common critique, as it should be. So when I'm talking about specifically MSM, I'm not referring to trans women, but as it stands in terms of data collection, right? Because we have to think about this in terms of who is incorporating trans women under MSM, right? And it's usually people who are collecting data, public health, epi data. However, that is there's a huge disconnect. There's definitely a lot of conversation around changing policy around that. We definitely subscribe to that idea and believe you should not include trans women under MSM. So here in the context, when I'm speaking of Latinx MSM, I'm specifically talking about men who identify as men. So this can include trans men, but not trans women. Does that clarify your question?
I think, well, she'll let us know over chat if it did.
Okay, excellent.
Great.
So again, here there are many terms, many ways of referring to cultural competency. Many of you may have seen a lot of these. And again, here the point is the sort of the root and focus of all of these lenses, whether that's being culturally humility, culturally effective, multicultural competence. It highlights culture as a main factor in terms of understanding difference, right? Or a lot of these terms, and even the idea of cultural competency, a lot of the research that backs it comes from education, right? And essentially looking at how we learn as human beings, how we learn and communicate, and how culture plays such a large role in that, which is why that was sort of the emphasis in understanding and advocating for more culturally competent work, right, and awareness of these frameworks. So here we have just a brief definition. There are so many different ways that institutions, researchers are defining cultural competence. This is one from Cross, which is one of the pioneers in researching cultural competence and the importance of cultural competence, and specifically in education. But a lot of these ideas that are incredibly relevant to education are also incredibly relevant to public health, because again, in education, you're sitting in a classroom, there's a lesson, you're learning, you're processing, right? And the idea is to learn and to question and to be able to communicate what you learn. In a public health setting, this is clearly you're processing, you're sort of taking in information about your health and what it means, and your own sort of not just what it means in terms of vocabulary, but also what it means in your life and in your lived experiences, right? So the idea of cultural competency, again, is to always strive to work, acknowledge differences, embrace the differences, and understand how this is constantly affecting our lived experiences on a daily basis, right? Across identities, whether that's informed by race, culture, class, sexual orientation, gender, etc. And even that sort of definition of cultural competence, here we have culture. I mean, the reason there is so many different ways of defining cultural competence, right, is because, again, there are also so many ways of defining culture and understanding culture. And I like, many folks have probably have seen the culture iceberg, and I like it because it's a sort of quick and dirty way of looking at the complexity of culture. The things that are usually more discernible, i.e. things on a surface level. So like food, flags, festivals, fashion, right? These things there's aesthetics, there's a look, there's an understanding of how we can code this by looking at it. However, it gets a little more difficult when you go under that, when you sort of try to understand that deep culture, right? So things like attitude, beliefs, behaviors, notions, body language, right? We understand that all of these things are informed by culture, and because of that, it's difficult, it's hard to really pinpoint and always be able to measure, right? So that's why it's so it's important to think critically about these lenses, i.e. cultural competency and how we're defining cultural competency, cultural humility, cultural responsiveness, right? We understand as providers the pivotal role they play in our work, but few times I would say because again, we have multiple roles and we have so many things to do that we don't often get the opportunity to really think critically about what these terms mean and how they're showing up in our work. So today I'm going to talk to you a little bit more about some examples of cultural competent work, and also to have us step back and really process what this means and how it's showing up in our work. So here you have an example of just thinking about culture and how ideas of culture show up in our work. So this is a study called The New Invisibles, and it basically was looking at HIV screening processes in 50-plus population. And basically, one of the takeaways from the study was that folks who are 50-plus, right, and I will say that this study, there were more heterosexual couples than gay-identified couples or MSM couples, right, in this pool. More of these folks would only get HIV tested, if even at all, during their sort of annual checkup, right? So why? It was a combination of things. It wasn't necessarily because they were not engaging in high-risk behavior. It's because nobody was asking them about the behavior. It's because there was a lot of assumptions being made about their sexual lives based on their age, right? And so with this particular study, it's just yet another example of the types of assumptions medical providers, but not just medical providers, I would say it goes beyond medical providers, but that people make about others, about their patients, about their clients, based on age, right? And sort of the notions that go along with, well, if you're of a certain age, then clearly you're not engaging in any sort of sexual activity, right? And that can be very detrimental to the work and to health, depending on the actual lived experiences of your client or your patient. So here, I'm not going to go too deeply into this, but many of you are also maybe familiar with the cultural competency continuum. For those of you who are not, there are definitely tons of resources online. This one specifically I acquired from the National Center of Cultural Competency, which is a good center. It talks about other research and different tools that you can use to talk about cultural competency and what that looks like in your role, in your work. So I wanted to highlight it because it is something that's often used in this work when we are discussing cultural competency. And it goes all the way, it's basically this idea of a continuum that any organization, just like any person, can be anywhere on this continuum, and that you can be in more than one place depending on the population, right? So for example, an individual can be culturally proficient, using the definition of the continuum with Latinx MSM, but can potentially be, culturally pre-competent or even culturally blind when it comes to working with African American women, right? And so it's the same person on 2 points of the continuum, right? So the continuum is helpful in the sense of helping a person place themselves and think critically about where they are and how they're defining competence and or their levels of competence and how they are actively or inactively looking for tools or strategies to work with folks across differences, right? So it's helpful in that sense. However, one of the critiques it's received is that it implies, if you look at the continuum, it stops at cultural proficiency, right? And it sort of implies that there's an ending point to cultural competence, right? That you know everything you can possibly know when working with a particular population, right? And I think that is problematic because there's no way, there's always room to learn and to grow. And I think that when you sort of position yourself to think that you know it all, this is, that's where sort of assumptions and biases can start manifesting and can start really disrupting the work. So I now wanted to take, I've been talking to you a little bit about cultural competency, definitions of cultural competency. So now I kind of want us to look at how this shows up in public health, right? Specifically with Latinx folks. So there have been extensive studies that have looked at cultural competency models with Latinx, and a lot of these tend to highlight values of Latinx populations, right? And so I want to mention a couple of these. And again, many folks may be familiar with some of these, right? There's personalismo, or basically informal friendliness is another way of thinking about this. Respect, right? Extensive studies talking about the importance of respect and how Latinos make sense of respect and power dynamics with doctors and nurses. Fatalism, this idea of it's going to happen anyways, right? So why get HIV tested if there's no way to avoid it? Why get a cancer screening if there's no way to avoid it, right? So these are some values that have been documented and talked about and unpacked. Idea of collectivism, right? Where it's not just about the individual, but about the family. And then comadrismo we have here, which is basically this value referring to this intimate and respectful and trusting relationship between women or Latinx women, right? And so there's been extensive studies identifying these values and depicting them and illustrating how, what they look like and how they work in sort of the medical settings or public health. And so I want us to actually look at some of these examples. So this, I'm going to read it, but this is literally, I extracted it from an online resource that has amazing tools, really great tools about cultural competency. So I wanted to sort of dig a little further. So I'm going to read it. This is hierarchy in Latino families. Latino families are often stratified based on age and sex. Generational hierarchy is expected: grandparents, child, and grandchild. The oldest male, direct relative, holds the greatest power in most families and may make health decisions for others in the family. Latino men traditionally follow the ideal of machismo. They are expected to be providers who maintain the integrity of the family unit and uphold the honor of family members. Women follow the ideal of Marianismo, which refers to the high value Latino women place on being dedicated, loving, and supportive wives and mothers. So, as I said, this is a direct quote from an online source talking about cultural competence and using cultural competence as a framework. So as you read this, there's a couple of questions, or when I read this, there's a couple of questions that come to mind. So after reading this, what is being implied here? Are there assumptions in this paragraph? How is truth being told, right? So these ideas, these notions, even this concept or perspective of hierarchy in Latino families is based on research. So there's some truth to it, right? However, is this true for everybody? So after reading the passage, I thought to myself, does this or does this not dismiss the role or existence of single-parent households, where many single moms are raising children, right? Absent of a father who is the power figure. However, what about if the oldest child is actually female, right? In my family, my sister was the oldest. So when it came to helping my mother make decisions, she was the one who went to appointments and translated and helped my mother make a lot of decisions, right? Even though there were other 3 younger boys. So again, these passages can be useful, gives you a glimpse, gives you a snapshot of a cultural occurrence, but it's important to really look deeper and question them so that we don't get into mass assumptions, right? Another example. So this talks about Latinos and uncertainty, right? So this is a little bit about like timing. So it says, many Latinos definitely treat time as flexible and do not value punctuality the way their healthcare providers may expect them to. In fact, within the Latino community, not being on time is a socially accepted behavior. This explains a tendency for Latino patients or parents to show up late for healthcare appointments, fully expecting to be able to see their provider. Similarly, Latinos are more accepting of certain levels of chaos and don't expect orderly processes. So again, folks, what is being implied here? Other questions. So not being on time is a problem, right? However, is it because people's lack of keeping time, track of time, or is it because there's no transportation to make it to the appointment on time, right? Is there a language barrier? And that's why it's difficult for folks to figure out a location or get directions or find resources to get to their medical provider. This idea of accepting certain levels of chaos is sort of, I believe, is deficit-based and sort of positions Latinx folks as naturally unorganized, and I say naturally in quotes, naturally sort of accepting a certain level of dysfunction. And I sort of think these ideas are problematic. And again, these are tools that are being used to teach cultural competency. And I think that it's really important to think about the lenses and the tools that we're using when we are in the pursuit of cultural competence, right? Overall, this also reminds me of, before I get into cultural humility, right, as sort of this nuanced version of cultural competency, right, this nuanced version that sort of allows us to ask more questions. Another critique of cultural competency is that, again, you have these sort of snapshots and these stories that people then internalize and then pretend to know what it means to work with Latinos. One case was where there was this patient, female patient, crying, very upset, in pain, and in this, there was a nurse. This nurse who, when asked by the doctor what's happening with the patient, the nurse replies, oh, this happens all the time. Latinos or Latinx folks are very overdramatic and express themselves, but she's fine. And so the doctor immediately remedied the situation by walking over to the patient, doing a screening, and actually giving the patient painkillers. While the nurse, again, who had said, I took a cultural competency class in college, I know what it means to work with Latinos, was very, very quick to dismiss the pain of the patient by operating on this idea of cultural competence and thinking she knows what it means definitively to work with Latinos or Latinx. So again, really, really important to take a step back and think about what are the frameworks that we're using and how we're using them, and to really question it, is it working and how is it working, right? So I say all that to say, right, one size does not fit all. In the research that supports ideas of cultural competency, yes, there's research that's been done. Yes, there can be some truth to the concepts and the values that I just described, but those are individualistic experiences, right? And even if they're a group of commonalities, you can't possibly describe an experience for the entire group of people, right? To assume that all Latinx folks sort of interpret and process and understand themselves and their lived experiences the same exact way. So as a sort of response to that, we have this notion of cultural humility. So this is just one operating definition of cultural humility. And it's the ability to maintain an interpersonal stance that is other-oriented or open to the other in relation to aspects of cultural identity that are most important to the person. So basically, just when you think of being humble, you think of immediately, I'm open to suggestions, I'm open to discuss, and I'm open to learn, right? The assumption is not, I know it all, right? And so when we're practicing cultural humility, we're constantly incorporating the other person, right, that we're trying to treat, that we're trying to talk to, that we're trying to communicate. We're constantly incorporating them in this interpersonal process where, as service providers, we're trying to help, right? Depending on our role, again, trying to test them, engage them in care, help them take their medication, help them make them to their appointments, whatever the potential cultural barriers that exist. As a provider, it's really important for me to constantly ask the patient or the client about their experiences and how the information that I'm providing can affect them, is affecting them, and what are they thinking about that, right? And these three sort of tenets, you just sort of think of them as three tenets of being culturally humble, or cultural practices that are culturally humble. They take into consideration and emphasize a lifelong commitment to self-evaluation and self-critique. So this is from the perspective of the provider, right? It basically means self-assessment, and really check those biases that you may or may not have, right? But again, this is a lifelong process, so there is no ending point. There is no point where I reach full cultural competency or cultural proficiency. Yes, I may be culturally proficient, and I'm not denying that. However, there's still more to learn. There's always things to learn, because we're always dealing with human beings, and human beings and communities and cultures are constantly shifting and constantly changing. And again, addressing power imbalances and sort of developing partnerships, right? So this commitment to develop partnerships, basically think of it as developing allies, building relationships so that others can advocate for the community that you're attempting to serve. It's hard to do this work. It's hard to, again, this is why it's hard to be, quote unquote, having an ending point to cultural competency, because there's so many variables and there's so many factors that influence and inform our daily lives, right? So race, ethnicity, sexual orientation, our geographic location, our socioeconomic status. And by no means is this an exhaustive list. These are just some sort of major factors that inform our daily lives and our lived experiences that is really hard to measure with just one snapshot of what it means to be culturally competent. So this is where slowing down the process helps, and thinking about cultural humble practices. Being culturally humble is that you're aware of this, right? There's our human side. We constantly are learning. Categorical thinking is a very natural, right, cognitive process that we all do and we all use to simplify our daily tasks. So it's like we can identify food, we can identify what's edible, what's not edible, what's poisonous, potentially. And so using this constant categorical thinking is very useful and helps us to survive as human beings. However, when we start applying it to people, that's when it becomes problematic. Because then you have the expert bias that says, I have seen this before, I have all the information I need, and I know what I'm looking at. Right? So this is when you apply categorical thinking, a natural process, to now human beings. And so at play, here we have, stereotypes, right? Stereotypes can be naturally occurring in the sense that they are measurements of something that we know little or nothing about, right? So stereotypes as measurements are singular pieces of information that we need to build on to really understand what's happening. Stereotypes are problematic when you take that little piece of information and you apply it monolithically, or you apply it and you generalize it to every single person or every single occurrence or every single scenario that you then have moving forward, right? So that's when it's problematic. So it's important to really deconstruct these stereotypes that often, occur for all communities, and specifically because we are talking about Latinx, folks tend to, throw the entire Latinx or Latino group of people into one group, right? And we understand that there are several differences in Latinx folks, from language to customs, traditions, food, history, migration patterns. All of these inform who we are as Latinx, and there is no generalizable experience across the board, i.e., all Latinx are not Spanish-speaking, i.e., not all Latinx are immigrants, i.e., not all Latinx are Mexican, right? And these are things you constantly hear in the field. So it's important to really unpack who the Latinx in your community or who you are serving, right? And these are some things to take into consideration. I'm not going to go into all of these, but some I will highlight. So when it comes to understanding who are the Latinx that you are either designing programs for, providing services for, think about the role of assimilation. Think about the role of acculturation. Think about how these inform behaviors, right? What does sexual silence look like? Is there an absence of sexual discourse or discussion? And if so, where is that coming from? And if so, can that potentially be leading to other high-risk behaviors, right? the role of age, right? The role of immigration status. All of these are really are key to unpacking and segmenting and really understanding who your Latinx population is. Getting that snapshot that gets away from generalizations and becomes a little more specific and more human and more true to who you're attempting to provide services for. So I find this helpful in terms of another way of defining culture and sort of bringing it down to earth a little more, making it a little more accessible. And so culture can be redefined as what is expected, what is reinforced, and what is rewarded, right? And you can throw a variety of different examples here. So thinking about heterosexuality in culture, so something that's expected, reinforced, rewarded, having children, getting married, education, a Catholic belief system, right? All of these can potentially be cultural aspects that is expected, reinforced, and rewarded by the group of people that you work with or that you provide services with. And so it's helpful to sort of identify what is expected, reinforced, and rewarded, not only as a method of understanding how people define their culture, but also how they understand their culture, and also your understanding of your own culture and not projecting that onto the client or the patient that you're working with, right? So again, that emphasis on self-assessment and thinking about what potential biases may be there. So sort of to wrap this up, right, I wanted to talk to you about ideas of cultural competency that were often used. I wanted us to give us an opportunity to really question some of these frameworks and how they work and what they look like, and provide sort of another lens, right, or a nuanced lens that constantly has us question, but also put either the patient or the client, right, at the helm, right, where we are constantly checking in, asking about how they're understanding the information that we're providing, how they're understanding navigation of services, right, and the list continues. But it's moving away from those assumptions and those sort of snapshots where we think, I've seen this before, I know what it is, I've seen this movie, I know how it ends, which I feel many people do if they're not able to question their own personal biases or if they don't question the frameworks that they're currently operating under. So in order to sort of move away from that and try to improve the work at a minimum, it's important to think about what is expected, reinforced, and rewarded in your client's life, right? What are, sometimes when we talk to people about these concepts already in mind, those are our assumptions that we potentially may be making, to identify and note that people's choices, right, are often informed by what is expected, reinforced, and rewarded. And, it's at the end of the day, it's about try not to make assumptions, meeting your clients where they are, and understanding that building that interpersonal relationship is about perspective and relationship building. Great.
So I want to personally thank you, Michael. I think oftentimes when we've done trainings or webinars on this topic, we did have, 45 minutes to talk about this topic. People kind of expect sometimes coming into these webinars, when it comes to any population, to be giving bullet point lists about this is what you need to do. So I think the fact that we were introduced to frameworks about how we can look at culture to better engage our populations, it's good that you gave us this framework. And I think it definitely gives all of us here somewhere to start with as far as how we can start looking at culture to better engage our clients when it comes to, or working with certain populations when it comes to service provision. So one thing that I'm going to ask you to do very quickly, because I've seen you do it before, and I think it really does hone in on the idea of identity and behavior, is can you do this activity around the triangle that you've done before? I know it comes from a framework that I think really speaks to working with some non-gay identified populations or everything in between. So the way in which I'm going to do this is I'm going to draw this little triangle on the screen here, and then I'm going to let you kind of describe what it is, right? Sure. So very bad job of a triangle there.
So this is a framework that I use to sort of talk about human sexuality. So this is a sexuality triangle. And so sexuality is made up of our three main components, right? According to the framework. It is a desire or attraction, right? Behavior or sexual behavior, and identity or sexual identity, right? And so looking at the framework, or looking at these different moving pieces, behavior, desire, and identity, is helpful because it sort of helps us see how different aspects of our own sexuality are, how they show up, how they manifest, depending on the current cultural, the cultural context, the social context, the historical context, right? So i.e., being able to openly identify as a gay man in New York City in 2016, very different, right, than identifying as a gay man in 1940, right, if at all, right? Or, and even, again, even the notion of identity, even gay identity doesn't go back to the 40s, right? So, again, thinking about how identities and how behaviors are sort of separated and form each other, but they remain mutually distinct, and oftentimes are conflated. I think that's where a lot of confusion comes into play, i.e. when you conflate sexual behavior, having sex with a man, and assume that that infers a gay identity, which many of us in the field know that that is not true, right? Because for several reasons. Some of those reasons being people are not feeling safe identifying as gay, right? Or the idea that even gay as an identity is not culturally sound or makes sense to the person, right? Which is completely legit and valid, right? So the sexuality triangle helps sort of make sense of how our sexuality is constantly being informed by our lived experiences, our cultural context, social context, and of course historical context.
Great, and I think that's important to kind of think about, because I think oftentimes, especially in the work that we do, we throw around this term MSM pretty freely, right? So we oftentimes assume that, you know, that's another umbrella term to kind of try to give understanding categorically how we might want to work with clients. So this idea that, you know, sometimes you might have a client who has engaged in some sort of sexual act with another man, but doesn't identify as gay. Might think they might identify as straight or something thereafter. Or it might be someone that, you know, is a man who identifies as gay, who has never had sex with a man, right? So the desire is there, the identity is there, but the behavior isn't there yet, right? So again, understanding that sometimes in the sexuality triangle, it really kind of helps you understand where someone's behavior, desires, and identity might not always connect in the way we might expect them to. And kind of, again, reevaluating our preconceived notions about how we might want to look at behavior, sexuality, and desire differently. There is a comment that's made by Jose. He said, it is important to note that issues of cultural competency and linguistic sensitivity affect people of color. That is, non-whites should not assume that because they are members of a minority group, they are already equipped with the cultural competency and linguistic sensitivity needed to serve our non-white identified clients effectively. I think that's an important notion to kind of think about, right? That even though we might be people of color, it might not always make us proficient enough to work with other communities of color. So I think that is a great way of being self-insightful. It's a great way of, Michael's kind of applauding you right now. I see him kind of clapping. So thank you for that point. I think that's important for us to make that understanding and kind of conclusion sometimes. So what I'm going to do right now is I'm going to unmute the lines to kind of give the space to people to kind of ask questions. So, and again, if you notice, like in the beginning, it was pretty hectic as far as hearing people clearly. So if it doesn't end up working, we'll revert back to the chat function and kind of do it that way. So I'm going to unmute the lines, and even though I'm muting the lines, and I understand people don't feel comfortable speaking, so you can also still chat your question or comment there. So
the conference has been unmuted.
So the lines are all clearly unmuted. If anyone has any questions or comments, you're welcome to pose those now. Don't be shy. Great job, Michael. will do. So Esteban said, great job. Lines are currently muted. Anyone can ask a question about anything we've talked about.
Could you please repeat when we're going to be able to order tests and materials?
Of course, of course. So the website's going to go live where you could do that, and that's going to be mid-September, so around a month prior to NLAD. That's when we will have the website go live and you can order that information or those things online.
Great.
Could you guys go back to the culture, humility, and slide?
Cultural humility slide. Was there one specific? Let me see if I can try to figure out what you're talking about.
Defining it? Which one?
The culture plus.
No, it's the culture, humility.
There you go. That one.
Yes, thank you.
Okay. Did you have any questions about it?
No.
Ready? Great. Jose has another question. Will these slides be available to the webinar attendees? I'd like to share them with my colleagues. Of course. So what we're going to do after the call is I'm going to PDF the slides. I'm going to send it to everyone that was able to join us, and I'm also going to include the video recording of the PowerPoint, of the webinar itself, so you can also share it with your colleagues. Any other questions or comments? I'd like to personally thank Michael. I think Michael did a great job of kind of giving us a great way to kind of look at working with Latinx and Latino MSM communities. We can kind of break that down. And again, the fact that we're even, that you were able to define Latinx as clearly as you did, I think was very useful. And I think a lot of us, even now, we've incorporated into NLAD's title this year, so we've now started to go by National Latinx AIDS Awareness Day, which is I think is great, and kind of moving forward and being a little more culturally humble when working with communities, Latino communities, Latinx communities that might not identify as male or female, and understanding that gender identity is a spectrum, right? So you might not always be, consider yourself male or female, is a great way to kind of understanding and checking our insights a little better too. So yeah, Jose said, great job. So kudos to you. And if you have any questions moving forward, we're here to support you in the work that you do. And my email and phone number are on the screen. I'm usually better able to respond to you over email, just because I'm not always at my desk and travel pretty often for work. So I encourage you to send me an email, and I'll try to get back to you as soon as I can. Thank you all. Everyone.
Thank you.
Now I'm